Exactly. And on that same note, some medications only contain T4.
Right, Cytomel.
Right? Yeah, exactly.
Right?
They only contain T4. So it's worth noting, let's take this situation again. If you've got hypothyroidism occurring at the cellular level, you're not converting T4 into T3 appropriately, medication's not going to help.
Yeah. So, okay, so let's go here. So we've gone through, right?
Yep.
All intensive purposes, this client looks great.
So far looks fine.
Right.
Yeah.
I don't know what the problem is.
Yep.
Until we go right down here.
Boom.
There it is.
Boom.
Mm-hmm.
Okay, so what we're seeing here is the elevated thyroid peroxidase antibody, TPO.
Right down here.
Mm-hmm. This is a game changer. Now, this becomes an autoimmune condition. This is a condition known as Hashimoto's thyroiditis. In this case, this person's immune system is attacking her thyroid. In other words, the immune system is mistaking her thyroid for an invader, right? A harmful invader, and is destroying the thyroid. Presumably, even though her levels are pretty high, these TPO levels are pretty high, given how the rest of the thyroid looks, given the fact that her symptoms only came on within a year or so ago, presumably we're catching this pretty early, which is why the rest of her thyroid levels look okay. Allowing this to progress, we're going to see this tank really fast because the thyroid is essentially being killed.
Isn't that crazy?
Mm-hmm.
You think about that? Like your own tissue is eating itself.
Mm-hmm. Exactly.
Yeah.
Yep. Very common. I mean, what is
so common though?
Yeah, it is. Yeah, 1 in 8 women has an autoimmune condition now. 1 in 12 men. It's very common.
Yeah, and that's rapidly growing.
Mm-hmm.
We're seeing that. So,
yeah.
And I wonder too. I gotta wonder if it's because we're missing these pieces and we're missing the lifestyle piece.
Mm-hmm.
It's
Absolutely.
huge. The gut health, the lifestyle.
It is.
Okay,
Yes.
so we have a client now. We've seen it. We've figured it out.
Mm-hmm.
Hashimoto's.
Yep.
Let's point out too, we got a little bit of a low D3.
Yeah.
We like to look at that.
Yep. Low vitamin D.
Low vitamin D. But Hashimoto's, now what?
Okay.
Right?
So now this person's presenting with hypothyroid symptoms. Here's the thing. Still not a problem with the thyroid. It's a problem with the immune system. Again, giving this person thyroid medication can help take the edge off. More than likely, there's going to be this dance because of trying to regulate the amount of thyroid hormone as the levels fluctuate pretty significantly. And that's because as the thyroid continues to be destroyed, it releases varying levels of thyroid hormone into the blood on top of whatever's happening with the medication. So, big question, what do we do about it? Right? Big approach. The main approach is to figure out what's causing the dysfunctional immune system. We have to look for the source of injury. And I use the term injury because the definition of inflammation is the immune system's response to injury. That's it. It's the immune response to injury. Inflammation's not a bad thing. We just have to figure out what the immune system is responding to. So some of the main things that we would look at in this case, what's happening with this person's gut? How does their gut microbiome look? How are they digesting and absorbing nutrients? Do they have sensitivities to food? Did you know that the clinical research is pretty cut and dry, that gluten is just as much of a problem for Hashimoto's as it is for those with celiac? So could their diet be perpetuating this problem? Not could. How much?
Right.
How much is it?
Right.
Yeah.
Right.
Stress levels. What does their emotional stress look like? Do they feel like they have purpose in life? Do they feel like they have a connection to others? What does their nutrient status look like? What does their toxic load status look like? all of this will that's what our job is.
Right.
All of this we prioritize
We've got you.
for you.
That's what we want to say. We've got you, because right when you hear that, it is overwhelming.
It is.
Right. And then we want to shut down.
Yeah.
But that's where, when you really lean on a team of specialists or a specialist,
Mm-hmm.
they're going to go deeper and deeper and deeper with you. They're going to spend an hour, 2 hours, 3 hours, however many hours it takes to figure out what is this root cause. Otherwise, this client would go and they would get their pharmaceutical, they get their levothyroxine, and they would walk out and they would continue to have an autoimmune disease, and the thyroid would continue to be eaten, and the symptoms would never really,
they'll get worse.
they'll just get worse.
They'll get worse.
Right? And then you're constantly searching and spending more money and searching. Then you find a different doctor until you find the answers. So this is what we do to support you in this well-being. And it gets tricky when you present a certain way, but you've got one little, right? Like one little flag.
Right.
Bing.
One little thing.
That's it.
This would have been skipped even by the best of efforts. It would have been missed without running these antibodies.
So there's lots of solutions with the thyroid. There's lots of support. Like we said, there's dietary support. There's lifestyle support. There's supplement support, right? We have to look at the other immune function support. Like what's the injury? What's the offender? We see it all across the board of different things, even just like a trauma in somebody's life, right?
Absolutely.
So people will just kind of brush past that, but it's like that can be a huge trigger as well. A divorce, a death, a loss of a job. So we are going to help look deeper at the thyroid because it is so common.
So common and so important.
And so important and so overlooked.